very honored to have Dr. Scott Sears with St. Vincent Healthcare join us here on Montana Talks. Doc, first off, how you holding up, and I guess paint the picture for us what life is like with the hospitals across the state right now and over the past couple of weeks.
Yeah, good morning, Aaron. It's great to be on. It's been a pleasure listening to people this morning, and I'm excited to hear what questions people have on their phone calls. I would say life at the hospital has been different and yet not unique in the sense that this isn't the first time we've dealt with outbreaks of viral illnesses in the community. I think most hospitals have been prepared. They have what we call incident command teams, which are made up of physicians and healthcare leaders that meet every morning, every afternoon, every evening, talk about how many new cases there are, what we can do to prevent the spread, how can we prepare for people coming into the emergency room, how do we dedicate certain parts of the hospital uniquely for coronavirus patients or patients who need to be isolated. It really is a tremendous work in preparation because at this point, across the state of Montana, we know that officially there's 46 cases of coronavirus. There has, as of yet, to my understanding, be a single patient hospitalized with coronavirus or an inpatient with coronavirus, but every hospital, including our own, is completely prepared for the first one that comes in.
Well, now that's been one of the questions I've had, which is, okay, of the cases that we've seen of positive cases of COVID-19 or coronavirus here in Montana, it looked like they've all been, it sounds like every single one of them have just been sent home and basically told to quarantine at home. So I guess it kind of begs the question from some out there, moving forward here in the near future, is there a way that we can combat this virus without shutting down our economy entirely, but at least from a health standpoint, I'd imagine that's something that's being looked at.
Yeah, and I think that's a really important point, right? There's an opportunity cost to every decision in both trying to prevent the spread of disease and then once disease is widespread in the community, how you handle it at that point. And one of the things that we're seeing that I think it's really important for people to be aware of is we have a lot of patients who are calling in and saying things along the lines of this, which is, hey, I'm getting by with my diabetes and it's not perfectly controlled, but I can get by and I don't need to come in and I don't need to, see my physician because I want to leave space for them to see all these other patients. And that's one of the worst things that can happen is patients with chronic illnesses avoiding their physicians at a time when if their disease isn't well managed or well controlled, they frankly can be more susceptible to downside effects of the virus. So we have worked really hard to create what we call virtual visits. We have every single primary care provider with an iPad in their office that they can continue to see their patients virtually for those that don't need to come into the office. So patients don't need to postpone or cancel their care and therefore let their chronic illnesses worsen. And then when they get coronavirus, they're set up to have a far worse course. So we can see patients virtually. We have screeners at the point of entry of every single one of our primary care clinics. So people who have symptoms are fast-tracked into rooms and not sitting in waiting rooms. So those who do have to be seen because they have something that a doctor needs to lay their hands on, not just see virtually through a video, they can still safely come in and be seen as well. We have well hours in our clinics for kiddos who need immunizations. So your health systems and your primary care clinics are set up to handle both chronic illnesses and the coronavirus simultaneously in ways that don't force people to postpone needed care that they need to be getting to prevent a problem 4 or 6 months from now because they neglected their diseases.
That's
today.
A very good thing to point out here is that, the thing that it tells me is communication is key right now. Don't just say, I'm not going to worry about that. I'm not going to deal with that. I don't want to bug them right now. No, you can communicate with your doctor and then go from there. They'll tell you whether you need to come in or not. What are some of the biggest questions that you're getting from patients that are either calling you or calling your doctors?
Yeah, the biggest question, I would bunch them into two categories. One, there's a group of patients who are calling who have symptoms and are wondering, does this mean I have coronavirus or should I be worried about coronavirus? And the second group of questions is, how do I know when I need to isolate myself and come in and get testing? So that first question, as far as what symptoms do I watch out for, there are a large group of symptoms that obviously people can experience with coronavirus, but the most common symptoms are a fever, a cough, and shortness of breath. Those are the three symptoms that are most telling for coronavirus or COVID-19, whichever term you're used to using. Fever, cough, shortness of breath. There's some recent data that comes out that the loss of the sense of smell is actually a marker for the coronavirus as well, particularly in patients who don't have a lot of runny nose or sinus congestion. Still, if people have watery eyes, runny nose, ear pain, more kind of symptoms in their head, not accompanied by shortness of breath or a cough or even a fever, it's much, much less likely that they actually have coronavirus, and they're much more likely to have one of the other viruses that's still circulating around the community. In fact, I can share of the first 80 tests or so that we ran here in our community for coronavirus, 39 of the patients still tested positive for influenza. And so, one of the problems that patients are having now is that it's still the end of March. It's still super common to have some of these other upper respiratory viruses circulating around, and it can be difficult to tell the difference. But I would again say fever, cough, shortness of breath definitely merits a call to your provider to talk about whether or not you need testing and what the appropriate precautions would be. And let me just share what the testing issue is. There's a lot of bad media out there that doesn't accurately relay information, or it's just misinformation. Early on, people thought, well, I can't get tested because there's not enough tests available. That was never the case in our community. We had plenty of tests available. The problem in our community was you could run the test, you put a swab through someone's nose into the back of their throat and collect some cells, and you put that in a test tube, basically, that allows the virus to grow in what we call culture media. But that doesn't give you the result. You still have to send that test to a lab that has the capacity to run the test and give you results. And what we saw early in our community about a week and a half, 2 weeks ago is we could collect samples from all the patients that were coming in, but there were not labs equipped to be able to run those results. And so because of that, there's a long delay in getting those test results, up to almost 10 days originally. We've been able to work out with some labs the ability to get those test results back in about 2 to 4 days now. But we really are prioritizing testing to patients who it really makes a difference on. So patients who are in the hospital, patients who are public safety officers, policemen, people who work in the jail, healthcare providers where you really need to know if they have the illness, and patients over the age of 65 or those with what we call comorbidities. So chronic heart disease, chronic lung disease, diabetes, or for some other reason have an immunocompromised state. We're trying to reserve testing for those folks so we don't overwhelm the labs, so we can get the results back and make appropriate decisions for those patients who really need to know. If you're a 30-year-old and you have mild symptoms, we really don't need to overrun our labs requesting that test, because we're going to ask you to stay home for at least 7 days from the onset of your symptoms and at least 72 hours of no fever and improving shortness of breath and cough. And after it's been 72 hours without a fever and improved symptoms, then someone actually can be released to usual activities.
Doc, I remember, I think you and I, when we last caught up 2 weeks ago, you told me it's not if we get coronavirus, it's when. And then it was like later that Friday night when the state tournaments were going on, boom, it was announced that we saw our first positive cases of coronavirus. The question we kind of led to just before the break there was, okay, so for these 46 cases here in Montana that are positive for coronavirus, and you made the point that, hey, all of them are basically being sent home. Nobody's being hospitalized at this point. They're all being sent home and then quarantined there. So that's the good news. But when do they know they're in the clear? When can they go back to life as close to normal after a positive coronavirus test?
Yeah, great question, and one that a lot of people are calling in and asking. So when you have tested positive for coronavirus, and you're not sick enough to be in a hospital, we do typically send you home for home isolation. And then there's actually 2 routes approved by the CDC to clear people for regular activity, meaning removing themselves from isolation. The first is if people have 2 consecutive negative tests. We're not going to talk about that because we don't have enough tests and we don't get timely enough results to go that route. So the other way that people can be clear for usual activity is the following. You have to have three main things, and people need to remember these three things if they're positive for coronavirus. Number one, you have to be fever-free for at least 3 days without medication, meaning you can't just be taking Tylenol and Advil to control your fever and say, oh, I'm fever-free. People need to be 72 hours fever-free without medication. Number two, other symptoms need to be significantly improving, meaning your cough or trouble breathing has improved. Some people will continue to have a cough because it's very common to have a lingering cough for a couple of weeks after a respiratory illness. But people need to have a significantly improving cough. So fever-free for 72 hours without medications, other symptoms improving, and it has to have been at least 7 days since your symptoms first appeared. So if your symptoms showed up 5 days ago and you've been fever-free for 3 days, you still need to wait another 2 days before you're released to normal activities. So those are the three things that we're instructing patients in home isolation with a positive test that have to occur before they can be released from home quarantine.
Very interesting. That sounds like a relatively quick recovery, given everything that's going on right now, and how significant of a shutdown we're seeing from an economic standpoint. Well, Doc, I know there's a bunch of other questions folks have about, okay, hey, what about, we're seeing all sorts of things on the internet, which you always got to be skeptical of Dr. Google, things like, oh, well, what about this therapy? What about this treatment? Or I read about this, or I heard about that. I want to get your take on that. But first, let's go to some phone calls here, 294-0970. Aaron in Roberts, did you have a quick question or comment for Dr. Sears?
Yeah, I was just, I was wondering what the extent of the lung damage is when you get COVID-19. So I've heard there's a lot of lung damage and scarring in the lungs. Is that true, or?
Interesting. All right, go ahead, Dr. Sears.
Yeah, so really good question, and let me break it up this way. If 100 people get coronavirus, 80 of those 100 are going to have very mild symptoms. Low-grade fever, a little bit of a cough, maybe slightly short of breath. When you walk across one end of the house to the other, you feel a little bit more winded than usual. Those folks are really not going to have any kind of permanent or chronic lung damage. So 80% of people who get this do just fine and recover actually quite quickly. About 15% of people get pretty sick, meaning they may require hospitalization. And those folks definitely can suffer lung damage. That doesn't always return to 100% of normal, but with hospitalized supportive care, actually can make a really good recovery. And about 5% of people get critically ill and end up on a ventilator. And that's typically a condition that we call ARDS. People may have heard of that, or acute respiratory dysfunction syndrome. And really what's happening in those cases is an individual's own immune system is almost overreacting to the virus violently. And that's actually causing damage in the lungs. It's breaking cells, it's causing leakage, and it's actually that over-aggressive reaction that lands people in an ICU very difficult to manage. Their lungs get very stiff. They're very hard to treat even with the ventilator because it's hard to pump air into a stiff lung. It no longer is like a sponge. It's more like a leather canteen, and you just can't exchange air in it. So that is why we've been trying to flatten the curve so much, because it's that 5% of people who become critically ill. Well, if you take 5% of half of New York's population, there aren't enough hospital beds for those folks. There's not enough ventilators for those folks. And so if you can slow down the spread of this illness and do it at a pace where you can actually have enough equipment and medical providers and staff to care for them, then you can help manage them and reduce the long-term complications of lung injury in those folks.
All right. I had a question from Tim in Savage here. Actually, I'll get to that one next. Let's go to another caller here. We got Dave in Billings. Dave, you're on with Dr. Sears. Did you have a quick question or comment?
Yeah, Dr. Sears. In my pathology course, I took every week we had autopsies. This is back in the 70s. And the pathologist made it real clear that the pathologist has a lot of discretion as to what the cause of death is. Can that be politically related today?
In terms of, so are you suggesting, Dave, like could people be declaring a death the result of COVID-19 instead of another illness? Is that kind of what your question? question refers to there?
That's correct. That's correct. And the pathologist has taught us, again, every week for a year, I went to, attended these autopsies. Said, oh, yeah, some of these are very, very political. Is it a drug overdose? Was it trauma? Or did he jump out the window? Did he commit suicide? There's a lot of discretion as to what the cause of death is. To me, it could be very politically related. Now, is that, how about you, Doctor?
All right. Well, thanks for that question, Dave. Yeah, good to hear from you. Yeah, Doc Sears, your thoughts? Because I think I've seen some reports out of Italy where, some of the deaths, they did have several other illnesses, but they're recording all deaths as COVID-19 when it may have been from other reasons. But I guess that's part of what we don't know right now. But what's your take?
Yeah, really good questions and really good perspectives in the sense that it is so challenging as a physician even to determine cause of death in folks, right? Because death occurs because the lungs quit exchanging oxygen or the heart stops beating. That's what happens. That's the ultimate thing that causes death, right? There are a lot of contributing factors to that. And what we're seeing in Italy is the average age of death is 85 years old. Those aren't super healthy 85-year-olds walking around that coronavirus just hits, ravages, and kills. And so, yes, you attribute the death to coronavirus, but it's on top of multiple chronic illnesses, diabetes, emphysema, coronary artery disease, immunosuppression. There are multiple contributing causes, but the common factor is that those patients have coronavirus, and coronavirus definitely is contributing to or inciting the death. And the reason that I don't think there could be any sort of political is because the testing we have for coronavirus is what we call a PCR test. It's a very good test, and if we detect coronavirus, people have coronavirus, and it probably was impacting the reason those patients declined. And it may have not been the only thing contributing to their cause of death, but it definitely was a linchpin in contributing to the death. And that's important. The other important thing to know, and people don't realize this, is that the coronavirus PCR test, just because you had a negative test, doesn't necessarily mean you don't have coronavirus. People think that these tests are perfect. They're really good when they're positive because they're what we call specific. If you have a positive test result, you almost certainly have coronavirus. There's been some good studies that have come out of China, however, that doing a swab in the back of the nose, there are about 30 to 35% of patients who may indeed have coronavirus that the PCR test out of the nose is negative. And so just because you have a negative test, if you still have classic symptoms, your doctor may still be prescribing you to follow the same guidance, which is isolation at home for at least 7 days, fever-free for 3 days, and improving symptoms, even though you have a negative test. And so you may be surprised that your doctor is still recommending that with a negative test, but that's because the test isn't perfect if it's negative. But it's very good if it's positive, which is why I don't think it could be political.
What about vaccines, therapies, treatments? I mean, Dr. Google isn't always the best doctor to consult, but you're seeing all sorts of folks share all sorts of things on Facebook and elsewhere right now. Oh, well, I did this, or I'm going to do that, or I heard this guy did that. What should people doing? What should they not be doing right now?
Yeah, great question and a super common one. And let me just throw out my own perspective a little bit on social media. When it comes to these illnesses, I have been so impressed with the entrepreneurial response across America, which makes America great. They don't necessarily wait for the government to make every decision. It's like, hey, I can make a decision, and we heard that with Spencer Zogg and Dusty Richardson earlier on your show. You know, these are folks who are like, I can make a difference. What can I do?
And they made a better
there are,
mask,
however, an equal
them,
number of people who are asking, how can I make a buck out of this? And they're falsely spreading even vaccines, which was taken down off the internet yesterday, a company advertising a vaccine which does not exist yet that people can access, or products such as copper or silver or other things, and they can pitch it on Facebook or on Google in a way that makes it sound like there's an overabundance of evidence that it will help, and people will spend money on it because of the state of hysteria they're in. And so people really need to be cautious. So let me now say, what we do know. What we do know is that the people most likely to get coronavirus are those who come in direct contact with someone who has coronavirus, stays within 6 feet of them for a period of time of more than 5 to 10 minutes, and shares secretions. Those are the folks that are actually getting the disease. And so anything you can do that prevents
the contact is key. Yeah. We hear about all the, these, you're hearing Dr. Google and people saying, oh, well, I heard about this therapy. Oh, I heard about this treatment. So the question is, what can we do as individuals? What can we do in terms of self-care in order to help prevent things like the coronavirus? Dana via Twitter said, is the virus airborne? How long can it live on surfaces? So thanks to Dana in Billings for that question. Frank in Malta says, how do we know who has the virus? I mean, if we came in contact with somebody who maybe already had a chronic cough, sneezes because of allergies, are we to assume they have the virus? So, Doc, I know that's a bunch of questions rolled into one there, and we still want to talk more about self-care. Where do you want to start?
Yeah, I think really good questions. I mean, just building off the airborne versus how long it lives on surfaces, it's a great question that people are really worried about, because you hear all sorts of things on the internet and on news outlets that you can detect this virus in the air for really long periods of time, or on surfaces for up to days and days, like on these cruise ships. It's important for people to understand that detecting the virus on surfaces or in the air is different than that virus being able to cause an infection just because you can detect it. Again, going back to what we see is the highest prevalence of infection is when you're within 6 feet of someone for more than 10 minutes and you share secretions. If someone breathes the air in Costco and expels coronavirus into the air, it is extraordinarily unlikely that anybody is going to get that. Unlike measles, which we've talked about on this show a lot, which is very airborne. So just because we can detect the virus in the air doesn't mean that if you're sharing the airspace with someone, you're going to inhale it and get the virus. It really is transmitted through secretions as far as we can tell. At least that's the most likely way to transmit it. Now, those secretions can live on surfaces for a while, which is really important for people to wash their door handles, toilet handles, gas station pumps. Right? These things are important. You should be carrying hand sanitizer with you and using it, or some people use a cloth, when they pump their gas, because these can live on surfaces for a while. Again, it's very unlikely to get it that way compared to being in close proximity to someone. But just because you can detect it for 17 days on a cruise ship does not mean that if you touch that desk 7 days later that you can get it. It really is close contact with someone with active disease where we're seeing transmission of it.
Yeah, and to the self-care front, I know you and I were talking during one of the breaks, and you kind of made a point, if I remember right, where you said, okay, let's assume 4 people are in a room together, and I think this ties in with Frank's question from Malta. Okay, say 4 people in a room together, one person has coronavirus. You said 4 people in the room, one person has it. Well, one person may be likely to get in that room, the other two are likely not to get it. What is it about the other 2 that makes them less likely to get it? What can people do in terms of self-care to prevent a coronavirus infection?
Yeah, this is such an important question, because all you hear about, on the news channels is avoidance, bending the curve, isolation, quarantine, have to prevent coming in contact. The truth of it is all of us are going to come into contact with this virus at one point or the other, and many of us already have. And so, think about the Utah Jazz, right? Those who are basketball fans. Rudy Gobert, who is the most high-profile NBA player, first NBA player to be diagnosed with this, had just played an NBA basketball game 2 nights before his diagnosis, where he was sweating all over himself, grabbing the ball, guarding people, slobbering all over them.
Boxing
and nobody
out,
on the opposing team tested positive for coronavirus, and only one of his teammates tested positive for coronavirus. So this is not nearly as contagious as measles. Doesn't mean we don't take it seriously, but it means there are factors other than just someone has it, so therefore I'm going to get it. And some of those factors are things that people can be doing something about, which this sounds really silly, but people need to make sure they're getting adequate sleep. Staying up super late, watching news channels till midnight, 1 in the morning, and then getting up at 6 in the morning and not giving your body's immune system a chance to rest and rev up is putting you at risk, probably more at risk than you realize. Not exercising, just sitting around, and a lot of people have curtailed their activity because of this illness and not going to work, and they're more sedentary, sitting in an office at home. You still need to get exercise. It's springtime. Get outside. Go on a walk. I had a patient call me yesterday and say, I heard this was airborne, so therefore I shouldn't walk outside. That's crazy.
Yeah, get outside.
You need to be walking outside,
outdoors.
go to the park. So sleep, exercise, and Aaron, I know you'll love this because I say it every chance I get. Fruits and vegetables. in the grocery store, it's hard to get toilet paper. It's hard to get fresh meat. It is not hard to get fresh fruits and vegetables. Nobody has sold out of those, and that's
Good
shocking
reminder.
because
Yeah.
people can buy that, and that will do more to prevent you from getting this illness than people realize. So sleep, exercise, fruits and veggies, and like I said earlier, don't postpone your visit to your provider with your chronic illnesses, because letting your diabetes slip out of control, letting an inflammatory process slip out of control will distract your immune system and make you more likely to get this when you do come into contact with it. So don't postpone adequate or normal care of your chronic condition.
That's a good reminder again for those who may be just joining us or missed it at the very start of the show. But Dr. Sears made the point, like if you have a chronic condition, don't just put it off and say, oh, well, I'll deal with that once we get past all this stuff. No, contact your medical provider, contact your primary care doctor, and you'll probably have an online meeting first, right? But then they'll say, okay, hey, come in or go here or go there. So keep that stuff coming. That makes a lot of sense. More callers on the line here as we chat with Dr. Scott Sears, St. Vincent Healthcare, here for the full hour. Let's see, Mary in Kalispell, what's on your mind?
I was wondering if Dr. Sears approves of our family's method of keeping people away from you when they're sick. That's almost guaranteed to keep you well. And can I say what it is and then ask him what he thinks about it?
Sure, go for it, yeah.
In Glasgow, my mother had this multi-clove garlic salad, and we hardly ever got sick. And then when I moved to Whitefish and I was working in a convenience store, and there was all these people that would come in and say, how come you're never sick? You never get the flu. And I say, well, we eat this garlic that won't quit, and then we say like this, hi, how are you? And nobody ever comes within 6 feet of anybody.
It reminds me of that meme, Big Sky Country, social distancing since 1889, something like
That's
that. Yeah.
right.
Dr. Sears, what's your take? Garlic? I mean, kind of goes back to the self-therapy thing. Your take?
Yeah, so two things on that, and I'll be quick so we can get to as many callers as possible. Number one, yes, you're going to force people to stay 6 feet away from you, and that will minimize the spread of this illness if you eat that much garlic and breathe on them. But the second thing is garlic is extraordinarily effective in diseases that are transmitted by mosquitoes and other insects. And we don't think that's the case with coronavirus at this point because we've seen person-to-person transmission. But definitely in South America, a lot of those viruses, dengue fever, transmitted by mosquitoes, mosquitoes hate garlic. And so if you eat a lot of garlic enough that it diffuses out through your skin, insects are less likely to bite you and thus less likely to transmit a disease. So there's a lot of science behind that. Probably not so much with the coronavirus, other than it does keep people 6 feet away from you.
So, and also pack the garlic with you when you go fish Nelson Reservoir in northeast Montana next time you go too when the mosquitoes are out. That's a helpful tip there. Richard in Lewistown, listening to KXLO. Question from you, Richard.
Yes, doctor, I have a question for you. I'm a volunteer role with Council on Aging in Lewistown. We had to close down temporarily because of this virus going on. We don't know what it's all about. But the thing is, when I was taking food out to people that can't help themselves, or bringing out to-go boxes for those that to-go box, I made sure I wore gloves. Now, that's the proper thing to do.
Okay, good question. Thanks, Richard. So wearing gloves when handling, to-go boxes, meals, things like that, is that the right thing to do? Doc, what would you say?
Yes.
Yeah, absolutely. I mean, when we talk about personal protective equipment that we're wearing in our clinic as we come into contact with patients that are ill, we definitely wear a mask and gloves and eye protection because, again, we're trying to prevent secretions from landing on surfaces. So you wonder, well, why can you get it on your hands? The problem with the hands is that people touch their face constantly. I mean, just pay attention to how many times you touch your face in a minute. It's staggering how often you touch your eye, particularly now that allergy season's coming up and people itch their eyes. So if you wear gloves, it works as long as you don't touch your face with your gloves, because if you get the secretions on your glove and still touch your face, you haven't accomplished anything. So the gloves are almost a visible reminder to people, don't touch your face. And most people won't touch their face if they have gloves on, or at least they'll think about it. more than they will if they don't have gloves on.
And
but I would say if people are just not changing their gloves and continue to touch their face, gloves won't do squat for you.
And folks in the restaurant business would know this. Okay, if you're wearing gloves, well, what else are you touching the gloves with? So then you got to change out the gloves too as well. Quick one from Paul before we go to the next break. Paul had an email. And how likely is it someone may be positive for the virus but have no symptoms? You may have kind of covered this when you said that, yeah, people who are generally healthy and boosting their immune system, I mean, they may have the virus inside of them, but yet not have any symptoms and not even realize that they have it, right?
Yeah, and absolutely. And the unfortunate thing is we actually just don't have percentages at this point because we don't have enough testing kits. And so what you're seeing is some high-profile people who have been tested and they've tested positive and are now 10 days in and saying, I don't feel any different. Like, I have no symptoms. So clearly there's a group of patients who have this, who have no symptoms whatsoever. We just don't know what that number is because we haven't been able to run tests on asymptomatic people to see how common that really is. But it definitely occurs, and that is how this is more likely to be spread. Now, it's more common if you're coughing to get secretions on someone. So if you don't have any symptoms and you're not coughing or sneezing or touching your face, you're less likely to transmit it. But certainly there are patients who are asymptomatic who have this.
The big question a lot of folks are asking is, okay, we'll hunker down here for a little while, but eventually we got to get, because we got to get over the hump. We want to flatten the curve, shall we say, but eventually we got to get our economy up and running, or we'll have more harm to our economy and to healthcare overall if we don't get our economy back up and running. When and how will we know we're over the hump on this thing?
Aaron, that is such a powerful question. And it's one I almost laugh because so many people ask President Trump this question as if he has some sort of crystal ball and is some all-knowing czar of, hey, we know that in 13 weeks that we're going to be over this. And the reason people are so hyped up and hysterical is because of the unknown. We deal with this with patients all the time because we give them diagnoses and we don't know the prognosis. We don't know how long they have to live. We don't know what to do. And so what we encourage people is to, be present in the present and do those things with their loved ones that are valuable to them and make the most of these opportunities. And what we do know is that we can measure the curve. That the problem that's going to happen in the next 2 weeks, I guarantee it, is that testing kits and lab resources to run those test results are going to go up. And we're going to see the number of people who test positive go up. And that doesn't necessarily mean that the disease is accelerating its course. It just means we're detecting it more readily because we have better testing. In many communities, we see this in the flu virus every year. We test for flu early on in the season, and then once we know it's prevalent, we actually quit testing for it. So we never know how many people are there. But in coronavirus, I think the opposite's going to happen, is we're going to run more tests, more people are going to turn positive, and people are going to freak out and think it's accelerating, when really we just need to go week by week and see, okay, are we overrunning our healthcare system? Are people ever able to reacclimate in the community who have had and recovered from the disease and therefore less likely to spread it? And I do think over the next couple of months, we're going to see this taper off and people are going to get back to usual activities, but hopefully with some better habits.
Yeah, because, that's the question, especially when we hear that, of all the people testing positive, they're just being sent home anyway. And if you have mild symptoms, don't show up to get tested anyway. For a lot of us, that seems to be the answer is, okay, maybe we shelter the vulnerable. We quarantine those who could be most impacted by this, who are the most vulnerable to this. And then pretty soon here, hopefully the rest of the country can get back to work and get back up for business. But I know those are bigger questions.
Aaron, let me just say one thing on that, because we've talked about this prior on this show. There is a concept that we call herd immunity, and that is what public health is trying to accomplish with flattening the curve. Again, everybody's going to be exposed, but if you can pace it out, if you can create herd immunity, which means in a classroom of 30 kids, if 15 of them are resistant to a disease, then the opportunity to spread that disease within the schools or in large groups or populations goes way down. So if we can create herd immunity in our communities, then that will do far more than even a vaccine can do in preventing this disease. And I guarantee we can get to the point of herd immunity in the next couple of months, way quicker than we can ever get a vaccine, approved. Now, What we don't know is, can people get coronavirus a second time? Can it come back seasonally next year like flu does and mutate? And so the work on the vaccine is super important, but herd immunity is a concept that's going to help our communities know when they can go everything back to business, large groups associating together again with less risk of illness.
Well, Dr. Sears, this has just been great to be able to have your expertise with us on the radio. I know we're out of time for today, but hey, if you're able to join us again later this week or again next week, as often as you're available to come in or want to come back in, I know folks greatly appreciate it. So the door's always open for you. We appreciate your time.
Great. Thanks a lot, Aaron.